We are now going to transition over to our next segment here. And we are so pleased and thrilled to have Amy OLeary with us. She's the Director of Education for All at Strategies for Children. I think everybody knows Amy, and she was part of our planning committee, and she's just one of the great leaders in our early childhood community here locally and across the state. And so I will turn it over to Nneka Ibekwe-Okafor, who is going to be the moderator for Amy's session. And just to tell you a little bit about Nneka is, she's my colleague at the Center on the Ecology of Early Development. She is our inaugural postdoctoral research fellow for the Riser Network that we operate out of CEED. And so I will turn it over to you ladies to handle.
Hello, everyone. Thank you for joining us today. As Stephanie mentioned, my name is Nneka. I'm a postdoctoral fellow in the Center on the Ecology of Early Development. And today I have the honor of introducing Amy OLeary, the Director of Early Education for All, which is a campaign of strategies for children, an advocacy and policy organization that works to ensure that Massachusetts invests the resources needed for all children from birth to age 5. Amy joined Strategies for Children in 2002, and prior to joining the organization, Amy worked as a preschool teacher and program director at Ellis Memorial in the South End of Boston. In 2017, Amy was elected to a 4-year term on the governing board of the National Association for the Education of Young Children, serving as president from 2018 to 2020. Amy is a member of the Massachusetts Kids Count Advisory Council and the Massachusetts Department of Early Education and Care Advisory Committee. Amy also serves as the vice chair of the board of directors of the Children's Investment Fund in Boston and as an adjunct faculty in our very own Wheelock College of Education and Human Development. Amy earned a master's degree in public administration from the Sawyer Business School at Suffolk University and holds a bachelor's degree in psychology and early education from Skidmore College. Amy, we are excited to have you speak with us today and to share your expertise about the early care and education system here in Massachusetts. And before I hand it over, I think Stephanie mentioned earlier, but if you have any questions throughout the talk, please feel free to add them in the chat and I will go ahead and read them towards the end. And Amy, I'll hand it over to you.
Thanks so much, Nneka. It's so great to be here. It's great to see so many of you, and I see many of you on Zoom many days, and many of you could be giving the same presentation. So I do have slides, but I'm not going to use them. But we will include for the follow-up, just so because we have some, the data points that might be helpful to hear. So first, I want to join the Dean in thanking BU Wheelock for continuing this important convening and this important tradition. It has been such a cornerstone of the work and gathering in Boston and beyond. I also will, throughout my time, put some links in the chat so you can think about connecting that way, and then we'll include the slides in the follow-up materials. So first, as I sit here, I'm thinking of the educators and the program directors, the family child care providers, the school age staff, the CEOs and community leaders who have shown up for children every single day since March of 2020. And we continue to be inspired by this resilient and dedicated workforce, but we know that it's not enough to just tell them how much we appreciate them. I'm also thinking of our appointed and elected leaders. We are grateful for the decisions that they've had to make over the past year and the support that they have shown for children and families, especially our Commissioner of Early Education and Care in Massachusetts, Commissioner Sam, who I know we're hearing from tomorrow. And as we know, the health crisis has highlighted so many of the inequities in so many of our systems, and it has raised broad, concrete awareness of how critical and integral the early education and care system is, not just to our economy, but the future of the Commonwealth. And in June, after the murder of George Floyd, we worked with folks to develop a collective statement on racial justice, which over 30 organizations. And the last few lines read, "We call on all our elected officials at the federal, state, and local level to examine policies, funding, and practices with regard to race and racial disparities. We call on Governor Baker, the Department of Early Education and Care, and the legislature to consider racial and gender implication of major structural changes to childcare in the short and the long term. We cannot keep adding to the ranks of the working poor and especially disadvantaging women of color for whom the costs of inequitable compensation are greater. We recommit ourselves to achieving racial equity in early childhood and school age programs through advocacy, action, and program and policy change. Together, we will stand up, speak out, and work to dismantle the historical systems of racism and inequity. And that statement has been very powerful to be able to go back to remind us not only of the important work that we do every day directly with children and families, but the context that we are living in and how important that is to the work. And as we think about the future, many of you heard me say that we cannot call childcare essential for the economy and then continue to have 37% of educators in Massachusetts eligible for some form of public assistance. We cannot make decisions about the K-12 side of the system without considering the implications for babies, toddlers, preschoolers, before and after school and summer camp. We cannot give access to consistent testing to people in one part of the education system for COVID and exclude other people who have been working face-to-face with children. And we have set up the systems and silos that are no longer viable, and we must work together to build back stronger. Now our eyes are all open with how the old ways did not work for most people. And we know that families do not live in funding streams. We have created so many of these artificial barriers and limitations, and we've seen it in decision-making that's happened over the last year. And now we have a chance to do something about it. So one of the things we talk a lot about is the language that we use. So when you hear, and we've been doing a lot of advocacy 101s, not just for early educators, but even for legislature. We did a first year briefing for all the newly elected legislators through the State House, and then we've also had other meetings with them. So just thinking about our language, when we hear early childhood, we know that we know early education and care, child care, pre-K, preschool, early childhood education, birth to 3, birth to 5, Head Start, school age, after school, out of school time, and daycare, which I have pointed out to many reporters that is a dated term, that we take care of the child, not the days. And I had a reporter come back to me and say, well, that's the word everybody knows. I said, well, if you stop using it, we'll all use different words that better represent what we were talking about. So just remember, when we're thinking about advocacy, we have to make sure that people know what we're talking about before we start going on how important are, the work that we do. So kind of context setting, getting some understanding when you're talking to folks is important. We also know in Massachusetts, there's about 70,000 babies born a year. We have about 70, this is pre-COVID data, about 71% of children under the age of 6 with all parents in the workforce, and 16.7% of children living below the poverty line. A lot of this data is based on the 2010 census, and I know my colleague Titus is on the phone, and we can't wait to update this information based on the 2020 census information. And also, we're going to have to really look at the ways that COVID has impacted some of these data points. But we also know that in Massachusetts, historically, we have had about 55,000 children birthed through school age in the subsidy system. And then we've spent a lot of time on that piece of the pie. And what the last year has revealed is how many more children are in other parts of the system, and how we think about using public dollars in private programs is something that we're going to have to grapple with. We know that Massachusetts is committed to a mixed provider system, which really supports parent choice and parents making decisions about where to put their young children. We know that we don't have a state-funded pre-K program, and I think the answer to the question is that no state has compulsory pre-K attendance. As far as I know, there are states like Oklahoma, Georgia, Alabama, Florida. We're seeing states put more pressure on the state to provide it, but not for children to attend. And that's the same for kindergarten in Massachusetts. You don't need to attend kindergarten in Massachusetts. The compulsory age is 6. We are also and have been tracking kindergarten since we started our work at Strategies for Children. And we have seen a trend this year of families not sending children to kindergarten, especially families who had to pay tuition. And so we are eager to think about what's going to happen in September and how we make sure we're collecting data, but most importantly, better understand what the policies are and who gets to decide. So if your child did not go to kindergarten, Do they go right to first grade? Can they go to kindergarten? Could they stay in the early education and care program? So we've been working with Donna Trainum at DESE to better understand what are the, what are the logistics of that. We just got an email this afternoon from someone asking those questions. We also know in Massachusetts, we have 3 state agencies for education: Department of Early Education and Care, Department of Elementary and Secondary Education, and Department of Higher Education. And I know I saw some board members from the Department of Early Education and Care with us today. And we also know that the financing, we talk about delivering a public good in a private market. And this is somewhere where we really need to think about our language, about whether we're talking about subsidies or vouchers or contracts or nonprofit, for-profit, private pay, paying out of pocket, sliding scale, parent fees, tuition, and UPK. So when you think about all of these terms, and this can be part of our challenge when we're communicating with elected officials, is we use a lot of jargon, and people are trying to say, I want to help you, but I'm not quite sure what I should do. One of my most impactful meetings with a staff member of a legislative office was, I'm with you, I want to help, but you have to help me figure out what to do. So what we also know is COVID really has helped us look at the finances and better understand what the entire market looks like. And in the slides, you'll see my colleague Titus put together a slide that shows, most of the funding in early education is coming from parents. And most of the public dollars that are paying for early education and care is coming from the federal government. And so we need to think about those pieces as we think about changing policies, fully funding programs, and really thinking about how are we going to get more public dollars in the system, and what is that going to look like as a whole. We also know thinking about the early education and care workforce is critical. What we have learned is that 92% of the workforce is female, 32% are people of color, but the diversity decreases at higher levels of salary and credentials. We know that 1 in 5 in the workforce is the sole earner, and almost half report dependence in their households. There are 24 plus primary languages, and that we also saw a challenge of programs that had to either lay off or furlough or reduce staffing. And now we're hearing the other challenges about how we know we've been in a workforce crisis, but we know that it's going to be even more pronounced as we think about reopening and thinking about, as families return back to programs, what's that going to look like? We also saw many organizations, systems, and people respond to COVID-19 over the past year. And one of the things we did at Strategies for Children is started a daily 9:30 Zoom call, which many of you are 9:30 callers. I'm going to put the link in the chat, and you just fill out a Google form if you want to be part of it. And it's been a great opportunity to build a community, to stay connected, to get accurate information, and to really shift the power dynamic about who gets information from whom and when. And we've seen a feedback loop of collecting good feedback, sharing with our elected officials, and seeing some policy change. We also have seen the fiscal implications with the loss of the private dollars in the system. And also the legislature has supported and made choices about dollars, about supporting our subsidized system. We also know that you cannot open a newspaper, if you still do that, or read online about the stories of women leaving the workforce. We have talked to, folks that work in HR, folks that are running companies, folks that are really concerned about their employees, and how we are going to make sure that there's an honest conversation about what employees might need to thinking about their children, what's best for children and families, and children especially developmentally, and then what could that look like? Some of the things we saw during COVID is maybe a mom or a dad would take their younger child closer to their workplace and find childcare there. If more folks are working from home, what do those options look like? Will people need, 8 hours a day? Will there be more flexible schedules? So really thinking about what are these kind of interventions and the planning, because if we keep saying we can't go back to COVID the way things were before, then we are also going to have to adapt and change of some of our programming and some of the way we think about what we do. We did see relief from both Massachusetts and the federal government. So one of the challenges was to keep government going. The legislature continued to meet virtually, but typically our state budget is completed with a new fiscal year starting in July. And last year that did not happen. Our state budget did not pass until December or January of this year. In that state budget, though, we saw historical budget amounts with a 25% increase for early education and care. And one of the things that got created in the state budget was the Early Childhood Education Economic Review Commission, which is led by the joint chairs of the Education and the Economic Development Committees. And the charge is to review childcare programming, how childcare program funding is in the Commonwealth, and make recommendations for political legislative changing and funding and related policies as the commission deems appropriate. And sometimes when we talk about advocacy, we think that sometimes commissions are created because they don't want to deal with it, so they just put it to a group to figure it out. I don't think this is the case. I think our elected officials heard that we need help and support, and this is a way to a huge opportunity to really make some significant changes. The legislators are appointing the members right now. Some are named, some are chosen by leadership. So we are checking in to make sure that commission will start meeting soon. And we also saw the federal government come through. So Massachusetts got 46 million. This is all for childcare. In the CARES Act, $130 million in December through the COVID-19 relief bill. And then most recently through the American Rescue Package, Massachusetts is going to see $510 million for childcare. There's also additional dollars for K-12, additional dollars for cities and towns. And we know that we are going to need those flexible, stable dollars to continue to make sure that we can sustain. And then, as we talked about, building back stronger. Some of the tensions that we've observed is, when will parents bring back their children? What will that look like? I was on a call today that somebody said it was very clear last March when everything shut down. Reopening is going to be very different. And we're going to have to think about how we ebb and flow with that. And we also know there are tensions between the increased costs for programs to deliver the same experiences, and then thinking about that supportive workforce. So as I've been talking to you, I would love to have people put in chat, what's one word or one thing that's keeping you up at night when you think about your vantage point? So whether you're in higher education or you're retired or you're a program director, what's one thing keeping you up at night as far as getting through the next couple of months in our reality right now? So folks can just put that in chat. One thing that's keeping you up at night. So the teacher shortage, children with special needs, equity gap, burnout, mental health, access to vaccines, budget for running programs, lack of clear guidance for fall, keeping up with all the uncertainty, staffing, keeping my educators safe and compensated, how infants and toddlers with complex medical and neurodevelopment needs will be served in the system, financial sustainability, the infusion of money that's one time and won't be sustained, mental health, vaccine reluctance, mixed messages, proper communication. It's so helpful to hear where people are. One of the things, Advocacy 101, everything we do around this is how powerful our voices are. And we sometimes forget that, because it's easy to, when people are saying we're so important, but yet we're not seeing it being listed as a priority. And so when we think about a lot of these things that are keeping you up at night, we know that we have to think about solutions and actions. We can't be the only ones, but we have to think about what does it look like to maybe re-envision what staffing can look like. Will we finally make a decision about credentialing in Massachusetts? And I'm sure we'll hear more tomorrow from the commissioner. How will we think about compensation and getting an infusion of dollars to make sure that we're not charging parents more, programs can't be losing any more money, but that we have a funding stream that can support children and families? We know that Massachusetts is one of the most expensive states in the United States for childcare. We heard, I just heard somebody talk about what his family paid for childcare, and it was $42,000 a year. And while we know how important it is to support the subsidized part of the system, I don't know many people who can afford $42,000 a year for childcare. So really thinking about how are we best supporting children and families through thinking about the way we change the way we think about public dollars. Another piece we've been thinking and talking a lot about is this collaboration and coordination piece. And I spoke to a state rep who's very involved in emergency preparedness. And we talked about part of being ready for an emergency is understanding who will do what, when. So we've been thinking about how do we make this collaboration and coordination about being ready for emergencies. And we are still in an emergency as we see COVID numbers rising, as we see schools or classrooms closing, as we see the challenges with reopening and all of the logistics that go along with that. So really thinking about how are we using our bridges, how are we building bridges to other folks, and thinking about who's making decisions. We also know that we took many stands over the last year around testing for COVID vaccine and the vaccine distribution. And we know there've been a lot of feelings, and in the chat you saw about vaccine hesitancy, getting vaccine appointments. How are you supporting staff to have conversations? How are you really understanding the context where people are making decisions about whether to get a vaccine or not? So all of the pieces in chat are so important to think about, and just to remember about the human connections and how important the support that folks feel people they have other folks to connect and talk with, to work through problems, to share resources, which has been one of the beauties of the 9:30 call. So what we have seen is, as far as opportunities, is we've seen an increased public awareness and media coverage. We have watched reporters really want to understand and cover these issues. We've seen the additional funding. We have a new presidential administration. We hear that there's another infrastructure package that wasn't announced this week, but will be announced in the next few weeks, which is going to also include childcare and healthcare. We have new legislative sessions in Congress and in Massachusetts. And we know that the Department of Early Education and Care, while they have had to be a regulatory agency, they also have been working hard to better understand what the impact is of the policies and regulations that are being created, and then what's really happening in real life. And keeping that line of communication opening. We know they have done tons of engagement recently about their strategic plan. And we also know that there have been many surveys collected and data collection. And I know we have survey fatigue and we don't want to think about filling out one more thing. But when legislators say how many families don't have a subsidy but need one, we need to better understand the financial situation of families, which is not something we have typically collected. So really thinking about how we can use data to make better decisions and to really tell the story about what's going on. We also know in Massachusetts, we have the Common Start Coalition, and there was legislation filed for universal access to childcare. That there was a rally last month. There are legislative co-sponsors being, are signing on, and there are statewide chapters and there are local chapters across the state. And I'll put some links in chat about how you can connect with either your local chapter or some of the work that's happening on the statewide level. We're in the middle of the statewide budget process, which is going to be how do we maximize the federal dollars that we're getting and making sure that we understand what is one time and what do we have to build on. And then really hearing from you about highlighting bright spots. We have heard incredible stories of dedication, of problem solving, of maximizing resources from people who are doing this work every day. We have heard people really reaching out to legislators and elected officials So really thinking about how we change that dynamic, and remember that we are powerful, smart, powerful leaders for children, and we have a lot to offer elected officials as they're making these decisions. And also, the last thing I will say is you have to know who represents you in all levels of government. And we have done some advocacy 101s, and folks have been like, oh yeah, we know, but we know how important it is. And everything I tell you to do is going to come back to who knows who you are. We have seen with this new class of legislators that has come on, they have all joined the 9:30 call, and each one of them have started by telling us their story. And I will tell you that Zoom as a platform is very different than going to the State House and sitting behind a desk and meeting as a constituent or as an advocate. And sometimes just that setting can be intimidating. So we have had legislators share very personal stories about why they ran for office. Some have come from inside the State House. They've either been a staff person and then they decided to run for the office. Some worked very for a long time in communities on different issues, and then worked on campaigns, and then now have gone to the into the legislature. So the easiest question to ask is, how did you get to where you are today? And people love to talk about themselves. So, and you're always trying to think about how you can make a connection. So really thinking about knowing who represents you. And if we had more time, we would have everybody go live, but I'll put the link. It's wheredoivote.ma.com. And it is very simple. You have to type in your street, your city and town, and your zip code, and all of your information will be right there on one page. And remember, in Massachusetts, we all have the same governor, the same 2 U.S. senators. So U.S. Senator Elizabeth Warren and Senator Markey represent the whole state. We are happy to help you figure out who represents you and what you can do to reach out. We have templates for introductory letters and anything that you would need to help make that connection. I'm going to stop there. I see we have a few questions, and then I will put some things in chat. And Stephanie, I don't know if you have any reaction to what I said or want me to follow up on anything.
Well, I'm going to turn it to Nneka, because Nneka is going to moderate for you. Great. And I do see that I'll just start it off with Helen. I see that Helen has a live question.
Hi, everyone. Sorry that the connection was not that good, so we kind of on and off, and I would love to have the organizer, if you can send the chat history to my email. I listed on the chat, lilymom2@gmail.com, because we want to know what was talked about earlier and what we missed in terms of resources, links, and people's comments. So I wanted to ask everyone, as I also stated in the chat, there are increasing numbers of parents and families speaking up about their oppressed experience, bullied and discriminated against in school systems, especially in the Asian American communities. Again, culturally, it's a very private matter. So that's why the parents, kids, family, myself included, we try not to rock the boat. We're trying to be discreet and trying to think the teachers is always right, but not in this situation anymore. If educators and early childhood learning teachers enabling bullying and discrimination in the classroom, among parents, and also among staff, this needs to stop. So if anyone have any experience or any comments or suggestion, please feel free to reach out. We're organizing a community forum specifically on this. And I saw briefly on the chat, some of the educator has mentioned about inequality and cultural sensitivity training. But in my opinion, cultural sensitivity training, it's only the Band-Aid on the symptoms. The ideology is very embedded. And people, a lot of the educators assume what they understood about the parents and children and family, but they actually don't. So that's one of the biggest challenge right now. And it is an invisible pandemic, because children at early child, who learning age period, it's the most vulnerable time. And in Chinese, there's a saying, 3岁看大，7岁看 看老. When you are 3 years old, you can pretty much kind of see the child when she or he grown up as an adult. When the child is 7 years old, you can pretty much see how the child's perception will form and value systems will form as an old person. So that's the famous Chinese saying, 3岁看大, 7岁看老. That's exactly the age group that all of us in this conference are dealing with. So I would love and urge everyone to reach out. I have been to a public school educator for a long time, and as a diversity consultant, as a mom and a writer and artist, I have written and translated many children's books. And then I also urge all of you to include materials and learning curriculum activities of tolerance, peace, and unity, and especially anti-bullying, anti-discrimination in daily interaction with the children, so that they can be of a better learner and also more tolerant and kinder in school, and especially with teacher and staff training. And that's one of the most important thing right now. But again, how long would this training effect last? That's one thing that I would ask everyone to think about. And I really appreciate your questions and suggestions. And there's no other better timing than right now to ask all of ourselves in our heart and soul that what can we do daily to promote that in our own practice, in our words and actions of peace, tolerance, unities, and do something when someone needs help.
Thank you for that, Helen. And I agree. I think having space for adults to talk about with each other, to think about language that we're using, to understand child development and understanding how we can help support children. We talked about this as far as reopening schools, that meant if children have been not in the structure of school or attending to these social emotional, these questions, not to assume that children don't know what's going on, to really make sure that we have support for each other as adults, and that we're willing to have conversations. I put in the chat, NEYC has its equity, diversity, advancing equity initiative and the position statement, which helps with some of the language about how to have conversations. But I would love to follow up with you, Helen, and connect and see how we can help support the work that you're doing and get the word out for sure.
Yes, thank you so much. And I'm happy to translate for all of you into Chinese language, Mandarin and Cantonese. And I also know some Korean, Japanese, because I have taught overseas in Asia and Europe for a long time. And
Thank
I
you.
really like to help out. And myself, unfortunately have experienced, that in the South Shore School District, and would appreciate any effort to connect and to help to, solve this serious concern.
Thank you. Thank you so much for speaking up.
Yes,
Nneka.
I put my contact information in the chat already. If anyone wants to reach out, and I appreciate chat history be sent to my email so I can catch up with everyone's thoughts and suggestion insights. Thank you so much.
Thank you, Helen. So we don't have any questions in the chat, Amy, and I know we're at time, but I did actually have one question. So you talked about the different relief packages, and then we also mentioned, different groups and populations and communities that are in need. And I'm wondering, what are the conversations around connecting the dots between how funding gets to the populations we were all just talking about?
I think one of the things I've been hearing mostly from our national colleagues is we have to get the money out. We have to have ideas about how to do it, and we have to help initiate the collaboration and coordination. So if we have ideas, if we think about, whether it's supporting translation services, we've heard about transportation. We also need to think big and not just, we're so used to living in a scarcity mindset about, we'll do a little bit more with a little bit less. And we have to change the way that we think and think, what could it mean to attend for early educators' mental health needs in a way that we never have thought about that before? What would it look like to have a compensation package that maybe starts with relief, but it's built into a state budget that can continue on? And what could it look like if communities really looked at their landscape of the resources they have available and got authentic, accurate information from the community members about what they would want to see. You know, we believe that people can solve their own problems, but that we need support, and we need permission, or we need to ask for forgiveness as we think about all the ideas that we want to think about and see for young children and families. So thanks for the questions, Nneka.
Well, I just want to say thank you, Amy, for all of your thoughts and thank you all for such the rich questions that you presented. This conversation can go on and on and on. And I know that you are having the Fabulous Females tonight. Is it tonight? Yeah, so there is more, and there's 9:30 every morning. People can hop on and talk more. So I want to thank you for your time, for your knowledge, for your wisdom. And I think that you were the perfect segue to our next speaker, who's